Hi, I'm Kimberly Jones, and I'm going to be talking to you guys about urinary tract infections today. A UTI is an infection that occurs when bacteria enters into any part of the urinary tract, including the kidneys, the bladder, the urethra, or the ureters. E. coli is the most common causative agent, and UTIs are especially dangerous in the elderly population because of the potential mental status changes and sepsis that can potentially occur in these populations. So when we're considering what puts people at risk, UTIs are more common in women due to their shorter urethral size, and their urethra is more closely located to the rectum, which is where E. coli tends to reside. When we're thinking about other risk factors for women, wiping from back to front after having a bowel movement can put them at risk for an infection because they are potentially exposing themselves to E. coli. Sexual intercourse can be a risk factor for both sexes due to the bacteria that can be introduced. Kidney stones can allow for urine to be retained, especially if the stone is in the ureter. They may not be getting the urine out. History of previous UTIs increases your risk for recurrence of UTIs. If the patient has a diagnosis of diabetes or other immune disorders, or if the patient suffers from urinary incontinence, these can put them at an increased risk as it promotes a more warm environment for bacteria to grow in. In male patients, if they have an enlarged prostate or a diagnosis of BPH, this can put them at an increased risk for urinary tract infections, as they may not be fully eliminating all the urine in their system. Any retained urine gives bacteria another opportunity to grow and for the patient to become infected. If a patient is diagnosed with Parkinson's disease or Alzheimer's disease, this can also put them at an increased risk for infection. Patients with Alzheimer's may or may not remember to drink or to urinate. So if they're not drinking, they're going to become dehydrated. And if they're not urinating, then they're retaining their urine, and this puts them at a higher risk for becoming infected. Any type of structural abnormality or previous genitourinary surgery can also put the patient at a higher risk. So when you're working the patient up and preparing to confirm your diagnosis, a few things that you want to ask them include if they've had any pain or burning with urination. If they have, then likely the urethra is irritated and inflamed, and this helps confirm that there is likely a diagnosis of UTI because there is probably bacteria in there that is causing the irritation and inflammation. Ask the patients if they've noticed a foul odor or unusual color to their urine. Bacteria can be eliminated in various ways, and the cloudy urine or dark urine are indicative of an infection. Foul odor is also indicative of an infection. If a family member brings in the patient and reports increased confusion or just a change in their mental status in some way, ask how long the patient has been confused and how the symptoms are different from their normal mental status. That's usually the first sign of a urinary tract infection in the elderly, so we want to catch these quickly and be sure that we're correct so that we can get them treated and get them back to their normal status. Also ask about lower back pain, maybe lower abdominal pain, and you want to find out how long the symptoms have been present. If patients report itching with urination, you want to consider more of a yeast infection than a bacterial infection. So when you're examining the patient, percussion and palpation in the flank area may reveal some tenderness in that area, and it may be painful due to the inflammation and the infection in that area. If the flank area is tender, they may have infection in their kidneys at this point. The patients may have a low-grade fever, so when you're looking at their vital signs, a low-grade fever, 99, 100 may be expected. And altered mental status, like we said, is usually one of the first symptoms in the elderly population. So be expecting that. Ask them, do you know where you are, what day it is, who's the president, etc., to establish their level of confusion at that point. Other signs and symptoms may include a sense of incomplete elimination, hematuria, the malodorous or cloudy urine on the UA once you've looked at it, pressure or pain in the lower abdomen, fatigue, malaise, fever, and chills. So the most common treatments after we've done the UA and the urine culture to confirm the diagnosis, antibiotics will be used to treat it. Most commonly, this is Bactrim, Septra, or Macrobid, depending on the patient's age, allergies, and sometimes personal preference. Cipro and Keflex can also be used if necessary. If the patient refuses antibiotic treatment, there are over-the-counter and at-home remedies that you can discuss with them. Some patients prefer to take the azo tablets. Some patients just prefer to be treated with antibiotics and then do preventive treatment such as probiotics. So when you're teaching the patients, it's important to tell them to drink lots and lots of water, at least 8-ounce glasses of water daily to help flush out the bacteria. They need to take their prescribed antibiotics exactly as they are prescribed. Don't discontinue the medication just because the symptoms are resolving or have gone away completely. Take the entire medication for the entire prescribed amount of time. Teach the patients to urinate as soon as they feel the need to void and to not hold in their urine. This just increases their length of time that they're going to be infected and just promotes more bacterial growth. So they need to urinate as soon as they feel like they need to in order to flush out all of that bad bacteria. Thank you.